really in this sort of a different place in life, right? We're at the beginning of coming out of lockdown. We have no idea how long this is going to last, but this is a new space. So I really want to talk about what this period has been like and what it is like for people living in high risk in particular. So this really includes people with cancer, diabetes, high blood pressure, asthma, chronic lung diseases, COPD. I mean, the list goes on and on, right? Heart conditions, people with weakened immune systems. You all are at the forefront of your field, so you're very familiar with those with high risk and at high risk. So I'd like to talk about this. Barbara, we're going to start with you. Can you just sort of a level set for us? Tell us what it means to be high risk. And besides some of the conditions I mentioned, what are some conditions that qualify as high risk?
High risk really means someone who is vulnerable to develop harm from an illness. And high risk entails those conditions that you mentioned: diabetes, heart disease, lung disease, asthma, cancer. Those patients are immunocompromised and they're at high risk. HIV
Right.
patients also
Yes.
high risk. And then also people over the age of 65 are classified as high risk because as people age, their immune system weakens. So it makes them more vulnerable to infections.
I'm really glad that you brought up that point about age. We certainly were talking a lot about age in the beginning of the pandemic, and we still are, but we have to remember that that does put you at high risk. So, what did this virus, and I hate to talk in the past tense because the virus is still teaching us, let's be very clear. So what is the virus teaching us or highlighting to us about high risk people?
I think this is one of the clearest examples that we've seen where underlying health problems affect your health in total. And many of these underlying health problems are sort of asymptomatic. People don't feel their high blood pressure every day. They can deny their diabetes, but when it puts you in the hospital, puts you on a ventilator, that gets real. And so I think everyone in the entire public has had a crash course in both epidemiology and infection control, things that we all studied in our professional programs for weeks. They're needing to learn in 10 minutes.
And something else I think that's really interesting is that high risk people, Barbara, you mentioned a number of the conditions. We talked about some of the conditions and even age that makes someone high risk. High risk people maybe have always been more used to living with maybe the types of fears that the rest of us and the rest of society began to pick up. Maybe those with a weakened immune system or diabetes or hypertension, et cetera, have been used to taking certain precautions. And all of a sudden, the rest of us, high risk or not, have had to sort of jump into that game. What can we learn from people that are in the high risk groups, or maybe what have they taught us, during this time of coronavirus?
Simply, I would say, high risk people, they maintained staying at home. Staying at home to keep themselves healthy because they do have those underlying conditions. And everyone else needed to jump on board with the stay-at-home order, which is totally different than what we've been used to. It's just not a normal way of life. And all of a sudden, this pandemic happened and our lifestyle has completely changed. So slowly now it's progressing where people are going out. But I will say when I am out, and I go to the park a lot, our New York State Park, because it's wooded and it's beautiful and you're surrounded by nature, but it has gotten so crowded. And there are a lot of people out, and there are a lot of elderly there also, and they're not wearing masks when they're out. And I'm so surprised by that because they're not by themselves. There are a lot of other people around. So maintaining safety measures when you're out is really, really important.
No, you couldn't have said that any better. And I think you have a really good point about this idea that I think about some of my patients who may be cancer patients. In certain situations, they're oncologists or I advise them to wear a mask. And now the rest of us, whether we have cancer or not, we're being asked to wear masks. We're kind of adopting to a new set of rules, and it's been different. I want to switch a little bit. Tamar, you specialize in PTSD, which is so important, and you do a lot of really great work. We don't talk enough about PTSD, obviously a special of yours. So for high-risk individuals, what is this sort of compounding type of pressure and safety protocols and stuff doing to maybe high risk folks mentally and physically? The fact that they were high risk to begin with, and now we got all this other stuff that's added onto it with the pandemic. Can you talk to us about that?
Absolutely. It's an excellent split. How do we think about physical versus mental? And you're absolutely right. We know the letters PTSD, but we don't truly understand the impact. And so when we think about it, more focus is usually given to the things we can see on a chart. I know we have cancer, I know my diabetes level. And then we push our mental health needs to the background, and it doesn't go away. And rightfully, we should be taking care of the things that are more high risk or high need. But how do you differentiate that? Because if you're not in a right emotional mindset, you won't be making good decisions for your physical health. So both need to be addressed at the same time to reduce both of those risks.
I think that's a really excellent point. This idea of not foregoing our mental health because of our physical health. You're right; they're both important, and I think that needs to be shouted from the mountaintops, if I might say so myself.
I agree.
I mean, yeah, it is so eloquently put too. Because yeah, I think that. I'm digressing, but the pandemic has brought out so many things in so many people, whether we're high risk or not. And often we talk about sort of the mental aspects of being a part of this pandemic, and it is just as important. So anyway, let me get back on track. Phyllis, you brought up a really, really important point, which is earlier on, this idea of racial health disparities and how this pandemic has really sort of brought out and illuminated. It hasn't created health disparities, right? We know health disparities have been going on forever, but it's really illuminated those. So I'd really love, Phyllis and Tamara, if you can comment a little bit. Black Americans, we tend to be more impacted by more of these high-risk conditions, the ones we've talked about. But how does that fit into the conversation about PTSD? And if I can just maybe complicate that a little bit more, we're also in the midst of a Black Lives Matter sort of resurgence or awareness, right? Black Lives Matter has always been here too, but right now we're in this heightened sense. So how does all of that go together? PTSD, Black Lives Matter, and then the fact that African Americans, we tend to have these higher risk conditions.
Well, I keep thinking it's a perfect storm because we are also more likely in communities of color, Black folks, Hispanics, to be in essential jobs. So we don't have the same choices of working at home as many of us do on this panel. We have to make decisions about, do I go to work? And do I go to work if I'm not feeling well? Does it mean I lose my job? Does it mean I lose, a lot of jobs, if you don't work, you're not paid, which further exacerbates your mental health, anxiety, depression, and or your physical health, because often healthcare is tied to your work. So can I get my diabetic medicines or my hypertension medicines? Or if I lose my job or my money is less, what do I decide to spend money on? Do I keep a roof over my head and food for my family? Maybe I let my medicine go. As Patty said, sometimes you don't feel hypertension or diabetic symptoms. So I think they find themselves in a midst of a relentless perfect storm.
You're absolutely right. And Tamara, what are your thoughts? And is there a PTSD component involved in this perfect storm, as Phyllis has talked about?
I think it's a double whammy with COVID-19 and all the other risks. It's like recurring trauma. You're going through a period of uncertainty. We don't know what the end point is. We don't know if there's going to be a second wave. And so we truly don't understand the full impact of what is coming, neither physically or emotionally. But the second piece is that there is a painful historical context to this that we push it to the back of our mind in order to progress in our day-to-day lives. But with it's impossible to escape the imagery that's on TV and in social media. And so there's a resurgence of that. And with that, a reoccurrence of trauma. So it's like Phyllis said, it is a perfect storm. And I just want us to be mindful that we often get through these tough times, but those scars will remain. And it might not be for a few months that we truly see the real impact of what these two social situations have brought together that will leave that lasting impact that we will need to take care of in a few months.
You're absolutely right. Patty, I want to get your take on this too, if you wouldn't mind kind of weighing in. We're in like this perfect storm. What are your thoughts about all of this?
Well, the Latino population that I work with constitutes 30% of the California population. California is a very diverse state. We don't actually have a majority ethnicity in California. And yet, even though they are 30% of the population, they also express a much higher level of disease, and the disease goes into younger individuals. They're way overrepresented when it comes to the 17 to 35-year-olds. And I loved what Phyllis said, is they're not staying home. They're doing the Instacart shopping for the people that can stay home. And if they don't do that shopping, they don't get paid. So there's not really an option for them. Actually, we were the only free clinic in the East Bay that managed to stay open despite the shutdown.
Oh, wow.
Well, more have reopened, but it was a huge challenge because we're a mobile van. And how do you socially distance when you have 2 exam rooms and 4 volunteers and 2 patients? We like to let them in the van also. So it was a lot of work on the advisory board figuring out how can we continue to deliver care. The transition to telemedicine has had mixed blessings, but most of our patients love it because these are people that are already working multiple jobs just to make ends meet. And they may not have childcare, they may not have transportation. And to be able to do telemedicine has been a boon. At the same time, the privacy compliance, there really aren't good tools for us because we often need more than just 2 people on the phone. We need more than a clinician and a patient. We might need a translator, we might need a scribe. And none of the tools will do that for us yet.
Yes, those are very excellent points. And we're going to actually come back to the telemedicine piece. I'm glad you weighed in on that. And also to hear a little bit more about the work that you do. It's remarkable. I mean, I know you all do amazing work. You really are, I mean, literally at the forefront. And it's such a blessing that you all are in the field. So thank you all, I have to say. But again, I digress. So Barbara, let's come back to you because you had mentioned a point about going to your park that you love to go to and noticing that more and more people are coming out and about, and also noticing that there are some people not wearing masks.
I think the state is right on. They're doing it in small waves, opening certain things up. I know everyone is eager to get out. They want to go out to their favorite restaurants. They want to sit and go to the bars and have a drink. They just want to get out living. But you really have to be mindful that there is a new normal out there. And that means you're going to be wearing masks. You're going to be socially or physically distancing yourself from others. I mean, those are just the givens that need to be taken into account. And a lot of people, though, still are not following those. And even if the states aren't mandating masks, I really think it's important for the person to recognize that they can be in control and try to help prevent others from getting sick, because they could be asymptomatic, they could have COVID and not even know it, and they could pass it to a vulnerable person, an elderly person or a person with a health condition. So it's about, I really think it's about being mindful and awareness. So when you're out also, if you see people that are coming close to you, move quickly away. I mean, I think we're becoming so different though. I used to always say hello to people whenever I'm out. Now it's like, all right, stay away. It's like you want to make sure you're at least 6 feet away from people. So I think our lifestyle is changing.
Yeah, no, our lifestyle really is changing. And you mentioned a lot of great points. Of them, of course, wearing masks and social distancing is our new normal. I'm like you, I'm like, if somebody tried to, this is a little interjection. Somebody tried to talk to me. I was doing my daily walk. I live in Philadelphia. I was walking down the street. Someone started to talk to me and they started coming towards me like you would like pre-COVID. I was like, whoa. I was like, stay back. You can ask your question. Come back there. You don't need to come closer. I got you. Let's talk about our high-risk patients, right? Because we all see patients. We are all involved in patient care, put it that way. And so, Barbara, you mentioned this idea of we're going to need to wear masks and social distance, and those are basics for everybody. What other things do our high-risk patients need to keep in mind? Are there additional things for them?
I think that we are realizing slowly and gradually what the reality is. So when people say, oh, I'm so glad to be out, I need to get out, a part of them, I think, is saying, I need the disease to be gone.
Ah.
And to realize the difference in
Mm.
that from what we're doing. My personal story is
Mm.
we said goodbye to one son without giving him a hug or a kiss because he had just flown on an airplane and he's headed to Japan. He's in the Navy and we may not see him for 3 years. And then our other son pointed out that the schools are anxious to reopen. That makes sense. But he's a teacher. And so he gets exposed to everyone. And he said, I don't think you're going to be able to visit once the schools open because my husband's in his 70s and has a heart condition.
My heart is breaking, like literally. I'm sorry. I mean, and these are the stories of so many people, but it's heartbreaking to hear that. And it's so sad. Tamar, can you help us through this, because there's some trauma associated in this too, right? What Patty's even talking about and what the rest of us are feeling even as she talks about her story.
And it brings up so many feelings for me because I see it daily, even missing my patients. Just being able to read that room sense, it's not the same with telemedicine. So you miss quite a bit from the family connection to your co-workers, to your patients. But I think there's a general consensus that we need to all say it's okay to ask for help, particularly for those individuals who have lived with multiple comorbid disease. Their way of getting through this is knowing what to do, when to do it, and doing it themselves. And this is a time particular to say to them, ask for help, and for those around them to offer help without them asking. One point I would like to make is that we have been asked to physically distance ourselves from others as the only way we could possibly curtail the impact of COVID. And in doing that, we've also socially isolated ourselves from others, which is a thing that as human beings, we need to survive. And anything we can do to replicate that in a virtual sense might be one of the short-term solutions to stopping this traumatic effect that emotionally and mentally it's having on us. So Zoom, face calls, everything you can do on your phone, doing that for others without them asking. Instead of sending a text, I'm going to FaceTime you. And letting them know that it's okay to ask for help, which is one of the primary things to say. I don't know exactly what to do for you, but I'm here just to listen. I found that to be incredibly powerful, attending to issues that I don't normally attend to, but just being there for that other individual.
Enhancing everyone's sense of control as much as we can. Isn't that a very important part, Tamar, of PTSD?
Oh, absolutely. Because what this has presented to us is a loss of control, uncertainty. And there are little tiny pieces that we can do to say, I can wash my hand and control the spread. I can wear a mask to control the spread. And even emphasizing the things that we can do gives you a sense of control in the tiniest bit of ways to allay some of those fears that we have.
And I do women's health. That's not technically mental health, but I recognize that everyone I'm seeing right now has losses and sorrows that I'm not aware of. And if the patient is comfortable sharing her loss with me, that's great. I am seeing people hands-on with lots of protocols in place, which our patients appreciate, but women's health doesn't translate to telemedicine as well. And the empathy is important. If she's not able to share those with me, I just need to keep in the back of my mind that I don't know what's going on in her life. And all of us need gentle. So when I see someone walking on the street without a mask, I'm trying to understand why that might be before I say, you need to put your mask on. There's something there. So that's that we're fragile right now, every single one of us. And if we can approach each other with empathy and kindness and understanding of our fragility and attempt to understand before we judge, we're going to be better.
That is so well put. I've noticed with my own patients, I've seen more anxiety sort of come to a boiling point in patients that maybe had underlying mild anxiety or situational anxiety. But I personally see more anxiety and depression symptoms than ever, sort of in this period of time. Patients really just feeling like they can't cope anymore. And I know as a healthcare provider, it's something I struggle with as well. I know my colleagues do in my department. I'm curious to know, and Patty, you've been so gracious in talking about your personal experiences, also your experiences in your practice. I'm curious, Barbara, Phyllis, and Tamar, of course, you deal with PTSD and a lot of mental health issues, but are you seeing more sadness, more anxiety, more stress? What has that been like, and what are your thoughts about it?
Tamara and I are working at a university in a school setting, and there's a lot of anxiety about when we might come back to the building, what that's going to be like, are we going to be protected? So one of the things that our community group had done was a health and wellness boot camp that was very successful in nutrition and activities for faculty and staff. And so now we're thinking about maybe we need to also take that same format and develop a mental health boot camp to help people address some of those kind of anxieties, maybe some stress relaxation, and that kind of thing. But I think there's many ways. I mean, people are anxious about jobs, about the reopening, about when to go out, how to go out. Is it going to be safe to use public transportation? So there's just a lot more things to be anxious about, I think. And I think helping people understand that yes, there are more things to be anxious about, but also maybe as providers, if there are ways we can help people to kind of keep it at a manageable level.
Well put. Well put.
So, it's a very interesting thing working from home and seeing my patients, and sometimes I'll get referral, and the number one thing I'm seeing is requests for sleep medication. And sometimes I can talk them through to talk about sleep hygiene without going to the medication first. But one of the things we know is that sleep issues is just one of the symptoms of multiple other disorders. And so it might be the start of one and something that we really need to pay attention to. And the medication might help for now, but it actually points to larger issues: anxiety, staying up at night, trying to maintain this routine at home with kids, and being accountable for yourself and doing all the things that you're expected to do at home and not being able to meet that. And I had one mom share with me, she said, I'm trying to be a good mom for my kids, and they're home with me and I can't deal with all of it. And I just want to be able to get enough sleep so I can deal with it. And it was such a minute statement because I know how hard she's trying. But her primary goal is that if she's okay, she'll be okay to take care of the kids. And admitting that, I thought, was just so powerful, because I know she didn't want a quick fix. What she actually wants is to be a good mom. That's all she wanted to be. And we talked through it, and she's like, well, maybe I'll turn the phone off. So she tried everything else, but it points to much, much larger issues that we really need to pay attention to. And it's something I'm trying to pencil down to say, it might not be a disorder now, it might resolve, but we really need to make a note of it because it might be the start of something we need to address in the future. I first want to take it off the individual. I want the persons around them to listen and pay attention to what they're saying. And equally, the individual needs to listen to their feelings and be okay with expressing that. That is the start, to validate the person around you's feeling and to validate your own feelings and accept that this isn't your fault. And in that moment, you're doing the absolute best you can. And when it's outside of that, then you seek help. I'll just put a plug in for not Google. Best website to go to would be the National Institute of Mental Health. And that takes you to quite reputable sites to process what you're feeling. That's one, but also find resources that you can reach out to.
Excellent. Thank you. Phyllis, did you have something you'd like to add?
I think that people will have to make decisions that are protecting themselves and their families. And I would say, make your decisions on what's best for your health and your family's health, even though you may be hearing contradictory things And I think if we look around the world, the countries that have done the best are the ones that have followed the public health and healthcare advice and not have politicalized what's going on.
It's a very great point. Excellent. Patty or Barbara, either of you with suggestions for dealing with anxiety and stress during this time?
What Phyllis said, and then look at places where you do still have control. Look, rather than what you've lost, what do I have? What can I make control? My personal story, I'm going to go buy 3 copies of board books and send one to each grandson and keep one for myself so that we can FaceTime read books together. We have that still. So flipping rather than what don't I have, but what do I have?
Excellent. Barbara, any final thoughts about recommendations?
There's a lot of misinformation, disinformation out there, so it's important for people to get the right information at the right time. Seek out the medical professionals, the scientists, websites. ShareCare has an excellent source of COVID information on there.
Excellent.
Let that be a source for people. The CDC actually has really good information as well to help people. Thank